Let me ask you a question. Do you know what you need to do to be totally healthy? Now, I don't mean generally what do you need to do. I mean, we all know we need to exercise more, we need to eat more greens. I'm talking about specifically, just for you and your body. Do you need to eat more of certain foods, for example, and maybe avoid others? Are there certain supplements that you need more of than another person? Do you need to do more aerobic exercise than strength? Are you maybe potentially sensitive to lactose or even gluten? Now, the answer to all these questions and many, many more can be found within our DNA. Hi, I'm Jonathan Bispham, the founder of Genetic Health Plan. And my story, very briefly, is that I've been an osteopath in clinical practice for over 25 years. Now, a few years ago, I was diagnosed with a condition and I wanted some answers. So I decided to get my whole DNA genome tested at a lab. And what came back was 700,000 codes relating to different genetic variations. I manually decoded those and found out some really interesting information, not just about the condition I was looking for, but also about many other areas of life. And it allowed me to tweak my diet, my exercise regime, my supplementation to minimize the risks that were showing up in my genetics. So I have a much healthier life now, and hopefully it will be a much longer life. Now, it was very clear to me that this information was invaluable, not just to me, but to everybody. So I put a team together and created Genetic Health Plan so that everybody can access this information easily. Now, I hear you say, I don't want to know. I don't want to know if I have a higher genetic risk of a certain disease. And that's fair enough, because let's face it, you're only going to worry. But what if? What if that disease was easy to prevent by making a few little lifestyle changes? Then would you want to know? Well, yes, I hear you say, as long as I find out what those changes are. And that's what we do. Genetic Health Plan is not really about the genetics. It's not even about the report. It's about prevention. It's about finding out what you need to do for your body to achieve optimal health. Now, how do you do it? I mean, is it a blood test? No, we've got rid of needles. We now do it with cheek swabs. Okay, so you get sent a kit like this. It has a couple of scrapers. You just scrape the inside of your cheek, pop it back in the vial, and send it straight back. So what sort of things can you find out? Well, you can find out whether you have snacking genes causing you to eat when you're not hungry and what to do about it. You can find out whether you have the FTO gene, commonly known as the fatso gene, which causes us to put weight on easier. And we'll show you how to reduce the effectiveness if you have that variation by 75% by just making a couple of minor lifestyle changes. You may find that you have a problem with a gene called the MTHFR gene, which could cause a build-up of a substance in your body over many, many years called homocysteine. This can be potentially dangerous and linked to many, many other diseases. It's a simple fix. It takes 3 to 6 months, but you have to know first that you have it. You may find that certain exercises work better for you than others. You may find that you can metabolize coffee very fast, or maybe you metabolize coffee slow, and that's why you feel very wide when you have a cup of coffee. You may find out that you have a tendency towards alcohol dependence, or you may find out that you break alcohol down extremely fast. You may even find out that alcohol is good for you in moderation and it lowers your cholesterol. There is so much information in this test that you can apply right now to your life so that you can have an individual health plan that's just for you, not anyone else, allowing you to live longer and healthier. So how much does this cost? Well, it's $695, about the price of a couple of months health insurance or 1 or 2 services for your car, depending on what you drive, of course. Now, the difference with this test compared to health insurance or car services is with this test you only ever have to do it once, because your genes stay the same throughout your whole life. What changes is the way you express your genes, and that changes by your lifestyle choices, as you'll find out in your Live Better Longer program. Now, there are certain people who shouldn't do this test, and those people are people who don't want to take any action. They're quite happy with the way their life is. They're not interested in changing anything about their diet. They're not interested in looking at supplementation. They're not interested in maybe having the odd blood test, and they're not interested in exercising. If that's you, then don't do this test. But if you're the sort of person that is interested in making changes in your life to improve your health outcomes, if you're happy to alter your diet slightly if need be, then this test is for you. And all you need to do is get online and we'll send a test kit out straight away. It's as simple as that.